The title of my research project is Implementation of a Pilot Pharmacist-Led Post-Discharge Transitions of Care Service. For the background, medication discrepancies during transitions of care can really affect patient outcomes when they are transitioning from the inpatient to the outpatient setting. The Institute of Medicine estimated that medication errors can cause both outpatient and inpatient deaths, and a big percentage of the medication errors are actually prescription errors that could possibly result in adverse effects. And the most recent National Patient Safety Goals state that it's really important to make sure that patient medication information is accurate to decrease the amount of medication discrepancies as well as to increase patient safety. And so as pharmacists, we are well equipped with the tools that are needed to perform a comprehensive medication assessment when the patient is discharged and follow up with those patients at their follow-up visit to reduce readmission rates and cost avoidance. So for this project, we implemented a transitions of care service, and our primary outcome was to describe and quantify medication-related interventions, and our secondary outcome was to evaluate the difference in 30-day hospital readmission rates. The patients that we included were 18 years or older, were discharged from the inpatient family medicine service, and had a scheduled follow-up appointment with the family medicine clinic. For the exclusion criteria, pregnancy was excluded, as well as any patients who were discharged to a nursing home, psychiatric facility, skilled nursing home, or long-term care facility. There were 189 patients that were identified upon discharge. 13 of them were excluded, 87 of them were unable to reach, and 89 patients were included in the analysis, and there were 9 readmissions. For the process of the Transitions of Care program, we had a pharmacist evaluate the discharge medication list, and these patients would receive a phone call from a pharmacist 1 to 3 business days post-discharge. Then the pharmacist would complete a comprehensive medication assessment with the patient, and if there were any discrepancies that were identified, either the discharging or the follow-up physician was contacted if a change needed to be made. For our preliminary results, the biggest percentage of prescribing errors that were identified upon discharge included incorrect drug selection, incorrect dose, or incorrect duration. And then for the percentage of errors identified after the patient phone call, the biggest percentage was either a missed dose or a barrier to access. So currently the study is ongoing, and we're continuing to evaluate the data to determine the effect of a clinical pharmacist post-discharge transitions of care service. And by completing the study, we hope to gain insight into how a pharmacist-led transitions of care program can prevent readmissions, save on healthcare costs, and decrease the rate of medication discrepancies to improve patient safety. Thank you.